Morning, everybody. We'll just wait till everybody gets in. We see there's quite a few have been very patiently waiting in the waiting room, so I'll just let people come in. So perhaps whilst people are getting comfortable, I might just kick us off. So I'm Sharon Friel. I'm Professor of Health Equity and Director of the Planetary Health Equity Hothouse, which is bringing you these Saving the World webinar series. I'm here in Canberra, in Ngunnawal lands, the lands of the Ngunnawal people that have never been ceded. So I really do just want to acknowledge the Ngunnawal people and pay respects to elders past and present. And I know that people are joining us from all over Australia and all over the world, and across Australia, paying respects to the traditional owners of the various lands and waters, and respects to elders past and present. So we're delighted to get started today. Another really important discussion about the big structural drivers of this intersecting issue of climate change, inequality and health. The key things that we are interested in the hothouse, and really asking the question of what are the conditions that enable change in the systems that are driving climate change, inequalities and health. So with no more blathering from me, I'd like to hand over to my colleague, Dr. Megan Arthur. Megan's one of the Laureate Research Fellows who'll introduce we're delighted to have our guest speaker today. So Megan, over to you.
Thank you, Sharon. I want to thank Jocelyn Cutler very quickly, who's within the hothouse who organizes these webinars. And I want to really thank Jess Beagley for being with us today from London. It's about 10:30 p.m. for her, so we really appreciate being with us, so late in the day. So we're thrilled that Jess is here. She's the policy lead at the Global Climate and Health Alliance, doing incredibly important work at the global level. And this work includes raising the profile of health in the UNFCCC negotiations, so the UN Framework Convention on Climate Change, assessing nationally determined contributions as key components of healthy and sustainable recovery. So these are reports that countries make to the UNFCCC, and hopefully we'll hear more about that from Jess. Working with national partners, so it's multi-level work, and working on local policy processes and research and analysis to support GCHA's campaign on fossil fuel phase out and other issues. So Jess has a background in public health and environmental determinants, with 10 years of policy experience in health and environmental issues, with an undergraduate degree in physiological sciences at the University of Oxford and an MSc in health and urban development at University College London. So bringing that interdisciplinary perspective, which we know is so important and we so value here in the hothouse. So we're really delighted. Again, thank you. I know it's late, and without further ado, Jess Beagley.
Thanks so much, Megan and Sharon. And I was saying just before everybody else joined that it's nice to do a turn when it's a slightly antisocial time in the UK, because I feel like most calls that I'm on with Australia, it's the Australians that are having to deal with horrible time zones. So hopefully you can see my screen now with a bit of luck. In terms of what I'll talk through today, I guess there are three parts to my presentation. One on the outcomes from COP28, then thinking through what's in nationally determined contributions, so countries' climate plans to deliver the Paris Agreement around the world, and what we can collectively do about any of this and what's coming up. In those three different parts of the presentation, we'll think through implications for or inclusion of health equity, whether that's power in decision-making or historical responsibility for emissions and finance and solutions to serve the most vulnerable populations. And then crucial to climate action and health action, but especially when we're thinking through a planetary health lens, also actions to be taken across sectors. In terms of how health showed up at COP28, this is a really great graphic that was put together by some other members of the health community. So huge turnout from the health community, thanks to it being the first ever health day that we've seen at a COP. As part of that health day, there was a ministerial that was attended by 50 or so ministers of health, and that number of parties to have endorsed the Climate and Health Declaration was 141 at the time this graphic was produced. It's now 148. In terms of the delegates that were in attendance from the health community, you can see that breakdown there in terms of how health showed up in different sectors and spaces. In terms of some of the non-negotiated outcomes from COP28, and I know Arthur's on this call, and a huge amount of this work was thanks to Arthur, and if Arthur wants to correct or reframe any of this later, then would really welcome that. But the Declaration on Climate Change and Health was a landmark shift in the ways that we've seen climate and health being spoken about at the national level. The fact that it's endorsed by 148 governments really cements the place of health at the heart of future COPs. No one can forget about health anymore. But some of the ways in which that declaration was exciting, apart from the sheer scale of support for it, was that it really breaks down some of the silos. It goes beyond the health sector, which is typically what we as the health community often focus on, and mitigation in the health sector is vital, but we can't forget about the other 95% of emissions that are driving the health impacts of climate change, or the co-benefits that we get from mitigating and adapting in other sectors. So the declaration does talk about mitigation co-benefits, refers to air quality, active mobility, and sustainable healthy diets. And on the adaptation side, it makes links between health and food and agriculture, water and sanitation, housing, urban planning, healthcare, of course, and then transport and energy. And there's also reference to a One Health approach. Notably, it also refers to partnerships with different communities that are typically most affected by climate change, including Indigenous peoples, women, children and youth, and so on. Some of the emissions that we noted were absent from the declaration are on fossil fuels, which are the leading driver not only of climate change and its health impacts, but also other health impacts along the line from fossil fuel extraction through to combustion, whether that's air, water and soil pollution from fossil fuel extraction, risks for workers at extraction and processing and transport points, or the air pollution impacts of fossil fuel combustion before the climate change has even been caused. Human rights also aren't mentioned in the declaration, nor are the responsibilities of high historical emitters to move fastest in mitigating, but also to finance transitions in developing countries. And I use the words developed and developing because they're what the UNFCCC use, and most of this presentation relates to the UNFCCC, but wouldn't use those terms in normal spaces. There's also an absence of mention of short-term actions and milestones, measurable targets and finance in the declaration, but none of that should detract from it being a huge step forward and something that we should really think through how to hold those 148 governments accountable to. In terms of finance for climate and health, there was $1 billion, I keep saying 100 billion, that's a different climate finance number, $100 billion for climate and health that was announced on the 2nd of December at COP. That's an aggregated total from a number of different donors. The full list is in a press release that will be linked at the foot of the link that's been shared there. In terms of next steps for this finance and thinking what's needed, there's a statistic that's a few years old now from the World Health Organization that estimates that somewhere between $2 to $4 billion would be needed to finance climate action in the health sector alone. So when we think about other sectors too, the level is likely to be higher than that. It's also really key that that finance reaches the most vulnerable populations, and also quite key to scrutinise new climate finance and commitments for health to check where that money is being allocated from, and that won't in fact inadvertently undermine health. There were also guiding principles for climate and health finance that were developed in the lead up to COP and also launched on December the 2nd. And that was thanks to the COP presidency in partnership with the Global Fund and the Green Climate Fund. That should say Fundación S. No, it shouldn't. That should say Rockefeller Foundation. Sorry, I've got everyone's faces over some of the text. It's nice to see your faces. Some of the strengths of those principles are the fact that it refers to finance being guided by the priorities of the most impacted countries and communities, an equitable approach and access. Things that are missing are around, there's language that points to fossil fuel subsidies, but fossil fuel subsidies aren't explicitly mentioned. We know that implicit and explicit subsidies for fossil fuels total something like $7 trillion annually. Universal health coverage could be financed with about $1 trillion annually, just for comparison. There isn't language that refers to new and additional finance, which is really key again, so that we can make sure that finance isn't being reallocated from, say, humanitarian funding and then rebadged as climate and health finance, because that ultimately won't serve health, especially in the face of the impacts of climate change. There's reference to greatest positive impact, but this isn't defined, and it will be really key to see how this is laid out. And then reporting on where and how that finance is allocated will be really interesting to see in the years to come, and the benefits of that. And you can see the principles again at that link. In terms of the negotiated outcomes from COP, I'll talk through mitigation, adaptation, loss and damage, and finance. I was told that there are 170 different agenda items at COP, so this is a really small snapshot of what got discussed at COP, but hopefully some of the bigger ticket items. So for the global stocktake, this isn't an agenda item that's only focused on mitigation, but it was where a lot of the mitigation discussions took place. So in the global stocktake, there is language that calls on parties to transition away from fossil fuels. This is really historic because it's the first time that language on transitioning away from all fossil fuels has been mentioned in a UNFCCC document. We'd have preferred to see language on phase out, preferably with a timeline and an end date, but this is a huge step forward for health and for climate change as well. Calls on parties to accelerate zero and low emission technologies, including abatement technologies such as carbon capture and utilization and storage. That's really concerning because carbon capture and storage is used as an excuse by the fossil fuel industry to continue its activities when carbon capture and storage hasn't been proven to work at scale. And there's also language on recognizing the role of transition fuels, which typically means gas. And it recalls that developed country parties should continue taking the lead in emissions reductions, which implies that that lead has to some extent been sufficient, and it's most definitely not. And there's a principle that cuts across different UNFCCC negotiating tracks called common but differentiated responsibilities, and that really reflects the fact that high historical emitters have profited from fossil fuel driven development and have a responsibility to not only reduce their emissions fastest, like I was saying earlier, but to finance the transition in developing countries. For the mitigation work programme, there were no particularly major outcomes which were disappointing, but something worthy of note from a health perspective is that air pollution and health co-benefits were discussed in a report for the mitigation work programme that was adopted in Dubai. For adaptation, a really key agenda item was the global goal on adaptation, and something to celebrate here for health was that there is a dedicated target in the framework that is going to be used to monitor progress towards this global goal on adaptation. Discussions on the global goal on adaptation have taken a while to pick up. It's actually mentioned in the Paris Agreement. When we think about the Paris Agreement, we think about the 1.52 degree target. And it's pretty easy to measure progress towards that. It's a pretty well-defined goal. You can count emissions, you know if we're delivering on that goal or not, and we're not. However, because adaptation looks so different in different countries, it's a lot harder to define that goal and also harder to define how we might measure progress towards it. So in 2023, 8 years after the adoption of the Paris Agreement, there is now a framework for monitoring progress, or beginning to monitor progress towards this global goal on adaptation. And the language of this health target is can be broken down into key parts. We can think about promoting climate resilient health services. So that's very much about action within the health sector. But then significantly reducing climate-related morbidity and mortality, which is really going to depend on action across sectors, not only in the health sector. And then thankfully, there is an emphasis on vulnerable communities. It's really reassuring that some of the other targets in the Global Goal on Adaptation Framework also refer to adequate food and nutrition and to potable water. Something that's missing from the targets, which has equity implications, is that finance and other means of implementation, which include technology transfer and capacity building, although they're mentioned in the wider text for the framework for the Global Goal on Adaptation, there aren't targets. So essentially been, can you hear me? Perfect, I got an error message about my microphone. Good. There is no target included on finance or other means of implementation in the Global Goal on Adaptation Framework, which means that developing countries have essentially been presented with a list of targets to make progress on without developed countries being held accountable for finance to deliver on them. I'll say a bit more about adaptation finance in a later slide. Something notable about the target is that it's quite vague. It talks about 2030 and progressively beyond. And then the language also in the target about significantly reducing climate-related morbidity and mortality. Again, that needs to be made more specific. As yet, there are no indicators under the targets, but I'll come on to that a little bit later. On loss and damage, so climate impacts, the Loss and Damage Fund was operationalised on the first day of COP. However, it's yet to be adequately capitalised. There are $792 million in the fund as of the end of COP, and you can see a graphic there from partway through COP. But that's about 0.2% of the 100 billions that are actually needed by impacted communities. The Loss and Damage Fund is also set to be hosted by the World Bank, and there are concerns around the high administrative fees that would potentially be levied by the bank. For the Santiago Network on loss and damage, this is the technical arm for loss and damage under the UNFCCC, providing assistance to countries in figuring out how they're going to address, monitor, respond to losses and damages, including health at national level. There is now a host for that Santiago network, and it's the UNDRR with UNOPS, and it's possible that through that we could better quantify and respond to health losses and damages. Quite often the extent of health losses and damages at national level aren't known and not easily tracked. On finance, last theme, COP. These aren't outcomes from COP, but the current status, and they're going to pave the way towards what gets considered at COP29 in Baku. So a little history of what's going on finance. In 2009, developed countries promised developing countries $100 billion annually by 2020. Even when we got to 2021, it was still less than 90 billion. Different sources suggest that 100 billion has now been met, but it depends on who's doing the counting. It's important to note that donor interests are quite heavily weighted towards mitigation. 27% of that 90 billion in 2001 was allocated to adaptation. And even though that there was a commitment in Glasgow at COP26 to double adaptation finance, nothing clear has really emerged from that, and we now know that we would need to do a lot more than double adaptation finance. It's pretty perverse that finance is weighted towards mitigation because every country in the world benefits when one country mitigates. So you can see some of the donor interests coming through there. When we think about climate finance, it's really important that this includes grants in addition to loans. because when loans with high interest rates are imposed on developing countries, this just reinforces cycles of debt and poverty and ill health where those communities can't pay the loans back. And then access to that finance for those that need it most. The finance has got to reach the people most in need, whether it's for health or any other issue at national level. A key sticking point around finance that we're going to see more and more of in future negotiations is that the EU and other developed countries want to talk about financial flows, which also includes private sector finance, for example. And there's some concerns that developed countries might be trying to shirk their responsibilities in providing that public finance to developing countries. And developing country blocs are obviously very keen on talking about delivering the $100 billion as was promised, and going far beyond that too. In terms of underlying interests and inequalities at COP, this is a bit of a mishmash slide, but just some of the different things that come through. So I talked already about the responsibilities of historical emitters, but just to put some of that into numbers, from 1990 to 2019, the wealthiest 1% of the global population was responsible for 23% of total greenhouse gas emission growth. Fossil fuel industry interests and influence are really coming through at COPs. Excuse me. The fossil fuel industry has made record profits in recent years, and it's really keen to hold on to them and not phase out fossil fuels. There were 500 representatives from the fossil fuel industry at COP26. There were 600 at COP27, and there were 24,000 at COP28. So it's quite possible that some of those loopholes that we talked through in mitigation were inserted by the fossil fuel industry and countries that are in close relation with them. Representation from most affected people and communities in the COP process is a real issue. Often people from most affected communities don't have access to passes. It's difficult for them to enter the admin system to attend COP. If they get past that barrier, they need to secure funding, and if they manage to secure funding, then they've then got to get a visa, and that's an issue year after year after year at COP. In theory, although every party in the UNFCCC has equal weighting, there are clear ways in which different parties are discriminated against. So AOSIS was actually absent from the gavelling of that global stocktake decision, which was the overarching decision from COP. And you can see a quote from the AOSIS lead negotiator on the right-hand side there, AOSIS being the Alliance of Small Island Developing States. And then all of these problems about finance create ripples of distrust, and at SB 58, which is the intersessional discussion that happens between each COP in Bonn in Germany each June, lack of finance to deliver climate action in developing countries was a reason that it actually took almost the entirety of the 2-week conference to even adopt the agenda, because certain developing countries said that they weren't happy to begin discussions on mitigation as a high-income country priority until there was real delivery on the finance that had been promised. There were obviously also other interests that wanted to keep mitigation off the agenda, but finance was a huge part of it. For nationally determined contributions, switching to part 2, which will be shorter than part 1, and part 3 will be even shorter than that. But this was some analysis that we did in 2023, so still related to a UNFCCC process, but something that they're documents that are prepared at national level, and like I said, they report on progress towards the they are plans to deliver the Paris Agreement. They don't yet report on progress. We looked at NDCs because they give a snapshot of national climate plans and priorities. We'd previously looked at how health showed up in NDCs, and for the first time in 2023, we looked at how clean air priorities show up in NDCs. So we looked at 170 NDCs, the most recent NDC by any party that's ever submitted an NDC. So that was by 169 countries and the European Union, which submits a joint NDC. We were interested in clean air because of the focus on fossil fuels in the lead up to COP28, and given the country it was being hosted in. And the links that were made with clean air and NDCs were really interesting because they showed us which countries wanted to foreground those links and might have been willing to link them to the need for fossil fuel phase out, and which countries were not. So we looked at 5 categories with 3 points available for each, so a total of 15 possible points across health impacts, air pollution, source sectors of air pollution, economics and finance, and then some bonus points, which for things like reference to WHO air quality guidelines, or using a WHO tool called the CliMac-H tool to look at the health and economic gains of emissions reductions, or attention to vulnerable populations. And then we compared all that to air pollution mortality data. Big thanks to the Clean Air Fund for funding that, Blanca and Iris, who did a huge amount of the analysis, and Pallavi from the Health Effects Institute that helped us out with the air pollution mortality data. In terms of what the ranking looks like, the top scorers were from lower middle income countries, Colombia and Mali being at the top of the ranking overall. Really strong showing from countries in the African region. Some of those lower scores were notably for countries that do produce and profit from fossil fuels. And then if you would like to see the full bar chart and all of the country cards, you can find it at that bit.ly link. In terms of what we found, less than a third of NDCs refer to the health impacts of air pollution or quantify that burden, while the majority of NDCs do consider different health harming air pollutants. Only 32 refer to different forward-looking targets. Skipped a slide, sorry. Different forward-looking targets, monitoring or projections. Only about a third of NDCs refer to actions to reduce air pollutants in specific sectors, and not many NDCs at all, only about 10% mention the costs of air pollution or budgetary considerations for air pollution actions, or returns on investment that are linked to air quality improvements. And of the 20 NDCs that got points in the bonus category, only 10 refer to air pollution impacts in vulnerable populations. So not seeing those needs come through nearly strongly enough. I will skip over, I think, the recommendations, but would really invite you to check out the report at the bit.ly link, which I can put in the chat a little bit later. And I know that this recording will be made available. But these are some of the things that it might be useful to take forward to national policymakers, if anyone had an interest in using the scorecard for Australia, which I'll show on the next slide. So for Colombia, we can see that the overall score was 12 out of 15. Colombia recognises the impacts of air quality on health, including respiratory health in particular, and it talks about the need for air quality action, including in the health sector, to monitor these gains. It plans for the health ministry to be really closely involved in that monitoring. It names different air pollutants, health harming air pollutants in its NDC, and includes reduction targets. It refers to multiple different sectors as sources of air pollution, and also aims to increase the modal share of cycling by over 5% by 2030 across different cities, noting the air pollution and wider health benefits of that. It uses this CliMac-H tool, which enables quantification not only of lives saved, but also of economic savings and returns on investment. And also refers to vulnerable populations. Australia, on the other hand, and sorry to shame Australia on a call with a bunch of Australians, but hopefully it's useful. Australia scores 2 out of 15, and the only points it gets are for naming specific health harming air pollutants in its NDC. So if low and middle income countries can plan to take these actions on air pollution as part of their NDCs, there's really no excuse for high income countries failing to do so. In terms of what happens next, some of the ways that we've managed to use the scorecard and might hopefully also be useful in Australia are at COPs. We found them to be really useful conversation starters. It's also helped us to identify champion countries that might be able to support the climate and health resolution that will be coming through the World Health Assembly this May. A colleague that does outreach to missions in Geneva said Australia was actually outraged that some of the work that was being done at national level wasn't reflected in the NDC and framed, and that this health work wasn't framed as being part of the wider climate plan. And then also domestically, it can be interesting to show the scorecard again to start that conversation and show where a country is doing well, and showcasing good practice examples of how air pollution or health considerations have been integrated by other countries into their NDC. We found it to be a really useful tool for strengthening future NDCs. When the very first scorecard came out in 2021, we were able to analyse the draft updated NDC from South Africa, and then worked with partners in South Africa and more widely in Africa to put together a submission to the consultation that was hosted by the government on the draft NDC to show what score they would have got had their draft NDC been the final one. And then the final NDC actually included much stronger integration of health because we were able to show where that could have been done. Coming up in UNFCCC processes, I've got one more slide, I think, after this one, and I'm done. So just to flag a few processes that might be of interest to engage with. So on the global goal on adaptation, I mentioned that we don't have these indicators yet, but there is a 2-year work programme to identify what the indicators could be to measure progress towards that health target, and suggestions for how health can be protected and promoted most effectively, especially among the most vulnerable populations, would be really welcome and really much needed as part of that process. There's a Just Transition work programme, which was the surprise outcome of COP27, appeared in the cover decision, and no one at the time quite knew where it came from. But it's a really great opportunity to be integrating health into the UNFCCC process. There are chances to think through the impacts of fossil fuel use on health and the need to maintain energy access as a key social determinant of health through energy transitions and protecting people's livelihoods and incomes, because we know that that's so crucial for health as well. But then also thinking through the need to extract minerals for solar panels or batteries as part of renewable energy systems, and making sure that we don't repeat those same impacts on local communities because of irresponsible extraction, as has been the case for fossil fuels. On the new collective quantified goal, which is this update to the $100 billion target that'll be agreed at COP29 in Baku. This will cover mitigation, adaptation, and also, we think, loss and damage, which hasn't been included in previous climate finance targets. And the discussion is currently open on how the scale that this finance needs to be at and what the new goal will be numerically, but also where it needs to come from. Of course, there needs to be increased public finance, but also thinking more widely about fossil fuel subsidy reform, whether and how private sector finance can be referred to in a UNFCCC process, given that that is a government process. And then finally, on conflict of interest, within the negotiations, there might be a chance to integrate it through a track called Arrangements for Intergovernmental Meetings, which is AIM. The UNFCCC Secretariat has strengthened its own policy around registration, so that it's necessary to declare if you're paid by the fossil fuel industry, even if you're attending on the delegation of another organisation. And then there's a really strong campaign called the Kick Big Polluters Out campaign, which is not part of the negotiations, but a useful thing to flag in that context. In terms, finally, of contributing to UNFCCC processes, if this is of interest, you can apply for UNFCCC observer status. If you're remotely interested, it's really worthwhile doing this soon. It used to take about 16 months. It now takes about 2.5 years. So useful to get that application in. That would enable you your organisation to send a delegation to future COPs. You can join a UNFCCC constituency. Often you don't need to be a UNFCCC observer to do that. So there's a youth network, Yungo, a Ringo network for research and innovation that includes universities. There's organisations like Climate Action Network. Often much easier to join some of those than it is to become an observer. GCHA runs a policy mailing list. It would be wonderful to have folks on it if anyone would like to be. Really, really crucial to be building relationships and working with colleagues across regions, understanding what the priorities are from different parts of the world, especially from people that are more affected by climate change or differently affected by climate change. And then to share COP passes, knowing that these are so restricted, and sharing funding to enable people who might typically be less well represented at COP to attend. Considering and applying lessons from across sectors and spaces, including on fossil fuels. And on fossil fuels, the things to think about here are not just the precedent that is set by the WHO Framework Convention on Tobacco Control, which says that the tobacco industry has no role in tobacco policy making, and there are some parallels that we can draw there for the fossil fuel industry and climate policy making. But also thinking through the regulation of advertising for fossil fuel dependent products, thinking through divestment, thinking through fiscal policies, whether those be related to taxes or subsidies. And to any academics on this call, please do continue conducting policy relevant research, and please do also work with governments and policy advocacy partners to help translate it. That's it from me, and thank you so much for your time.
Thank you so much, Jess. Just a massive range of issues discussed. Sorry, just fiddling with the settings here. Yeah, so really tremendous to hear and to learn from, you know, your incredible experience across the range of this kind of complex domain. And I think that's something I kind of want to pick up on as a first question. And first, I would say to everyone on the call, you know, we welcome your questions. Please start posting them in the chat or raising your hand, and we can hopefully bring you in to verbally ask your question. But I was really, you know, keen to hear. So, as an academic researcher, the kind of one of the closing statements that you made about the need for intersection with researchers and for policy relevant research. And I think you spoke a bit about some of the dimensions that are needed within that. But I'd love to hear a bit more about, you know, what you think is needed in terms of evidence base, in terms of resource sharing or resource gaps, and types of collaboration. I think that's really, you know, for me, I'm really passionate about that, about doing policy relevant research. And, you know, Sharon often speaks about the so what and you know, doing research for what purpose. So I think at this intersection between your work and some of our work and others on the call, there's incredible potential. So I'd love to hear more about that.
Thank you. I think somewhere where we see a really big gap is in the returns on investment that can be reaped from thinking about how we optimize the health co-benefits of climate action across sectors, whether that be for mitigation or for adaptation. It makes such a powerful case for implementation, but is also really relevant with so much of the conversation focusing on finance in the lead up to COP29. And then on thinking through the global goal on adaptation, data collection on the indicators that are going to need to be tracked at national level to make the global goal on adaptation worthwhile. Really useful to be following the process for what those indicators should be, but then once those indicators do exist, thinking if there are ways to support with collection of that data at national level. More broadly, it seems to be becoming increasingly important to try and link health impacts to be able to attribute them to climate change. There's pretty good data on that for heat, but not so much for other climate impacts. So I think they'd be my three wishes, and all not easy to implement, but I guess that's why they haven't been done yet.
Oh, thanks. Sharon has her hand up. But yeah, thank you for that response. Three very important areas, I think. Sharon, please go ahead.
Thanks a million, Jess. Really really interesting. And just whilst we're waiting for others to ask you, so you kind of, you live and breathe the politics of this space, you know, through your role. And you made a comment about some of the processes. So for the COP processes, you know, the declaration, so part of conflict of interest and the declaration of interest. But we know that just declaring interest, you know, what happens then? Folks might declare that they accept money from fossil fuels, they are fossil fuels, or the fossil fuel companies have supported, you know, attendance at COP, for example. But what then? You know, unless there's some teeth to deal with those conflicts of interest, it just becomes a register of interests. So the transparency is one thing, but needing accountability for it. Do you have a sense of how that might play out? Because that, you know, it's such an important governance question for these really important multilateral spaces. Do you have a sense of how that's playing out?
So maybe to pick up on the Climate and Health Declaration, just as an example of thinking through that. So there is a paragraph in that declaration that does refer to the need for follow-up at future COPs. So that could be a hook for having country reporting on what they've done that was of relevance to the declaration in the year that's passed since it was adopted. And really not to do that would be such a huge waste, because the content in that declaration, although it's not perfect, is so incredibly rich and better than what we've seen in other spaces like the G20, as an example. So any thoughts on accountability and follow-up that civil society can be doing would be really welcome there. We've got some very early initial ideas that we're thinking over internally, but would love to work with anyone on that that's got suggestions.
Yeah, I think, I mean, you know, we certainly have colleagues who've done a lot of work in that space, including Sharon herself. So I think that's, there's been some important progress in kind of nutrition spaces within WHO, within PAHO, and in other national contexts. So definitely some lessons to be translated into this space, I think. And that's actually one of the things that I'd love to ask. I have a million questions. So if there aren't other questions amongst the group, then I will be just taking that chair's prerogative. But so another one of the questions, and then I'll come to you, Nick, if that's all right, is around, you know, those intersections in different domains. So between health and environment, you know, the different kind of domains within health and the different aspects of the environmental issues related to climate change. So, you know, I just think there's this really complex environment of these intersections, and including social inequities. I guess the question is, how do you navigate that in the work that you do? So my sense is that there's been a growth of attention to health, and that GCHA as an organization, you know, you guys do represent sort of a hub among the health community working on climate change globally. I don't know if you'd agree with that. But first of all, how do you manage that explosion of interest in terms of your capacity as an organization, and then also intersections with environmental groups and, you know, kind of the Kick Polluters Out campaign and other kind of advocacy and policy dimensions of your engagement at that level? Sorry, it's a slightly large question.
I picked up on some parts of the question. I'm going to answer the parts that I picked up on, and if you want to repeat the parts that I don't cover, please do. So yeah, there was a massive influx of health organizations into the climate and health space last year, thanks to there being a health day at COP28. And that was actually one of the most exhausting parts of 2023, was trying to build these relationships with these new organizations so that everyone's priorities came through, but everyone was also aware of other people's priorities, so that any single thing couldn't be considered as a win for health. We really wanted the response to health at COP to be comprehensive, and at least for our own messaging and narrative, to be comprehensive and not having adaptation at the cost of mitigation or mitigation at the cost of finance. So we tried to build relationships, particularly with new health networks that were entering the space, and run webinars to brief them on what the UNFCCC landscape were and what some of the political sensitivities were, and help them figure out where their own priorities fitted in, but where the entry points were as well into UNFCCC processes for that, to bring those priorities through. In terms of work with the wider climate community, we're really fortunate to be members of CAN, and we host Climate Action Network, and we host a health working group within Climate Action Network. And we're also able to do coordination across different constituencies. So there is a growing health unit, I guess. There's a health working group within Yungo, the youth constituency. There's a SRHR and Climate Justice Coalition that's evolving out of the women and gender constituency. There's again a health thematic working group within Ringo, which is the research and innovation NGOs group. And then there are real champions for health in the Indigenous Peoples Caucus as well. So that's really, really helpful for making sure that our health messaging is attuned to what the wider climate community is calling for, because we know that the best thing that can come out of a COP is generally what the climate community is calling for, and it's just figuring out how we add the health voice to that.
Thank you. Yeah, great. That answers all of my questions. Nicholas.
Thanks, Jess. That was a fascinating presentation. I had a question about climate litigation as a potential mechanism for holding governments accountable. I mean, at COP26, you had, I think it was 34 governments, including the bulk of OECD governments, that signed up to the Clean Energy Transition Partnership, where they pledged to end international public finance for unabated fossil fuels. And despite signing up to it, a number of governments have actually failed to meet those commitments. For example, the Australian Export Credit Agency is being sued at the moment because it has continued to fund fossil fuels. We've seen the same thing happen in Brazil, South Korea, etc. And I'm just wondering if you had any thoughts on how climate litigation could in fact be used as an accountability mechanism.
I guess the initial part of the answer is yes, please, more of it. But in terms of specific avenues that I think have shown up, so the recognition of the human right to a clean, healthy and sustainable environment, I hope provides an additional hook for bringing health into some of those climate litigation cases. And then I'm going to blame the fact that it's a little bit after 11 o'clock and I can't remember the full term, but the ICJ process, the advisory opinion, and that there was a lot of fuss about last year, I know is also going to be really key for litigation, and I'm sorry for not having a more articulate answer.
I realize that I've been missing a number of questions within the chat, so I'll try to bring those in the time that we have left. So there's a few questions. Jess, I don't know if you want to hear a few and kind of give a response, or another question is whether anyone who put their question in the chat would like to come on and actually vocalize the question. Please raise your hand if so. You're very welcome to. So, or Jess, would you prefer to take each question one by one?
Any of the options are good options.
Okay. All right. So the first I have here is about investment in infrastructure, especially in quote unquote developing countries. Can you advise if there are plans to invest in infrastructure for mitigating the adverse impacts of climate change? So I'm not sure if that's a question about mitigation or adaptation. Perhaps the impacts part suggested it's an adaptation question.
So let me know if this doesn't answer the question. But I think a really key issue here is that most developing countries are faced with an onslaught of different urgent needs and priorities, and climate change, although it's urgent and very current, is just by nature of the fact that people need to eat and kids need to be educated, and people need to be protected from disasters that have already happened. Longer term, more preventive measures to address climate change, whether that be through mitigation or adaptation, don't tend to reach the top of the pile. And that is in huge part due to the fact that developed countries haven't delivered on their commitment to provide climate finance at the levels needed. Developed countries push quite hard for developing countries to include different budget lines and costings in their NDCs to say how much it was going to cost to implement different kinds of climate action. Developing countries have done that, and developed countries haven't kept up their side of the bargain. I hope that does some sort of job of answering.
Thanks. So there's two other questions that I have here. And one of them is about, so it's from the same person who asked the previous question. So they say climate change is negatively affecting food production security. Do you think agriculture sector has a potential to help reduce the emissions? So really kind of specific sectoral question there.
I think that really depends on which country we're thinking about the agricultural sector in. Plant-based diets are really key. They're really great for health. They help to reduce emissions. But the issue is around industrial agriculture and all the impacts that has on environment and on health. There is a significantly lower problem with a smallholder farmer that depends on a very small number of animals for milk and meat production in a developing country, especially when there aren't other adequate sources of protein in that setting. So yeah, agriculture can definitely plays a role in the mitigation side, but we need to be careful about how we message it and that we make sure that people have protected nutrition and livelihoods.
Yeah, the co-benefits and kind of externalities aspect. Yeah, really important. Thank you. So another question from the chat is about COP29. So I think looking for if you have any kind of sense of the priorities emerging that will be highlighted at COP29. Give us a bit of a forecast of that if possible.
Yeah, so it's really great that someone has actually asked that question, because I think given that COP29 is likely to be a lot smaller than COP28, some of the interest in the COP space has waned a little bit, but smaller doesn't mean less important. So finance, which is needed to deliver any of the sorts of climate action that we've talked about, mitigation, adaptation, loss and damage, or otherwise, is going to be the big ticket agenda item at COP29. So it's really key for the health community to be thinking through what it wants to see in terms of climate finance. But also I think we need to be quite careful in balancing that narrative and making sure that we don't only talk about how climate finance can be optimized for health, but also how health finance can be optimized for climate. We know there isn't enough finance for either. So optimizing what we have, but also calling for that new and additional finance is really key.
So optimizing at the intersections of these issues. Yeah, that's really interesting. I have a related question to that. And again, welcome if anyone else has anything they want to pop into the chat or jump on and speak about. But I have a related question about 29. And I think, you hinted at how this will be a smaller forum. And I guess my question is about the power or the importance of those COP spaces, those conferences of parties, compared to other multilateral forums. And I know that I have the sense that you've started to kind of look into, through your work, you do think about climate and health issues within other multilateral forums. So yeah, I'd love to hear more about that.
So one of the key ones is definitely the WHO processes and the resolution that's likely to be adopted at the World Health Assembly in May, we hope. There'll probably be an air pollution resolution that follows that in 2025. There's lots going on in UNEA that I am not as up to date with as I would really like to be. But that's also a really relevant space for decisions that relate to health and climate. I know that one of the key decisions that didn't go through was on solar geoengineering, which is essentially pumping things into the atmosphere in the hope of reflecting radiation back into space, so that, again, fossil fuel companies can continue emitting and ostensibly not worry about the impacts that that would cause. There's all kinds of problems associated with solar geoengineering, but that decision did not go through. So that's a good reason to be interested in the UN Environment Assembly. And then the Biodiversity COPs, CBD, Convention for Biological Diversity. I get the sense that they move a lot more rapidly than UNFCCC processes do. Again, not something that I've been able to follow in any depth, but certainly really key to be engaging from a planetary health perspective if anyone has capacity or is doing that already.
Yeah, thank you. And I don't know if, I mean, this might be a little bit of a challenging question, but one of the things that some colleagues here within the Australian Research Centre on Health Equity, they've done work around NGOs' strategies within public health kind of advocacy work. So I guess it'd be interesting to hear about, you know, in this intersectoral space that you're in, what are some of the key strategies that you have, and across those forums that you engage in, how they might vary between them.
Could you phrase that one more time? My internet is not completely cooperating right now.
Yeah, sure.
Sorry.
Sure, yeah. So there's been some work done out of the research center here around strategies for public health organizations advocacy. So this includes things like coalition building. I can't think on the top of my head right now exactly what those are. But yeah, so it'd be interesting to hear kind of what are the strategies that you've taken within the work at the multilateral level, and whether there's a difference in you know, across different forums.
I'm not sure what I think there are probably more similarities than differences between the approach that's needed in different forums. I guess it's always helpful to have evidence-based policy asks. You need to know what the opportunity is that you're trying to influence and the politics around it, who you want to reach, which sorts of narratives are going to resonate with the people that you want to influence, the partners that you want to involve to make sure that your message is credible to the targets that you want to influence. So I guess that's where the coalition building comes in, the partners that you want to involve, and using voices that might be more powerful than yours, especially if you work for a tiny organization like GCHA. So yeah, really grateful to have such a great network in the way that GCHA does in its members and partners. It definitely helps, and the messages that we put together carry further.
Wonderful. Well, I think that's a great point to wrap up on, and I will pass the mic to Sharon to close this out. Thank you again so much, Jess, and to Joss for organizing.
Thank you.
Lovely, thanks. Thanks, Megan, and yeah, Jess, really, thanks so much. Your knowledge across that whole system is phenomenal. We could talk to you for hours, so we must get you back. Thank you. So really, I just want to bring us to a close. Another fantastic Saving the World webinar. Please join us on the 18th of April for our next speaker, Matt Castle, who's going to speak about the some of the innovations taking place in the trade regime and all of the implications that has for climate change, and of course then for planetary health equity. So another really important space for quite significant action to take place that could be good or bad for planetary health equity. And then if you want to hear a little bit more, if you're able to come and join us in the building on the 23rd of April, we're just going to speak about the work that we're doing within the hothouse here in Canberra. So join us. I think the link has been put into the chat. So with no further ado, a huge, just a final thanks to Jess, to Megan, for everybody for joining us online. Look forward to seeing you the next time. Thanks very much.
Thanks so much, everybody. Thanks for the invitation.